Hello, everyone, and good morning, afternoon, or evening, wherever you might be in the world. Welcome to our second IEEE talk session. My name is Akatya, and I am representing the Academy portfolio. I'm joined by Kashish, Dean of the Academy, and Jess, our Admin Officer. We are so delighted to introduce Dr. Asmaa Al Rashed. Dr. Asmaa Al Rashed is a Fellow of the Royal College of Surgeons of Canada and a Fellow of the American College of Surgeons. She has received her training in general surgery at McGill University in Montreal, Canada, and she is board certified in general surgery. She has completed critical care fellowship at McGill University in and then laparoscopic bariatric and metabolic surgery fellowship in Laval University, Quebec City, Canada. She's practicing full-time as a general and a bariatric surgeon in the Department of Surgery and as an intensivist in the Department of Critical Care and Anesthesia in Al-Amiri Hospital in Kuwait, and works part-time at New Care Medical Center as a general and bariatric surgeon. Dr. Al Rashed is the Assistant Program Director of the Surgical Foundations Program in Kuwait Institute for Medical Specialization since 2017. A clinical tutor and a lecturer for 3 postgraduate programs, the Kuwaiti Boards of Surgery, Critical Care, and Pharma D. Dr. Al Rashed is a fierce advocate for empowering women in surgery. She is the founder of the Women's Surgeons Association of Surgeons and has championed the historical documentation and led many activities in tackling gender equity in surgery in the Gulf and the Middle East, among many other accomplishments. Additionally, she is a co-founder of the Women Surgeons of Kuwait Research Network that has encouraged and created research opportunities for many surgeons, physicians, and students. Under her leadership, the organization has spearheaded the production of clinical guidelines during the COVID-19 crisis and has conducted many research, educational, and learning activities. Thank you for joining us, ma'am. I would like to review a few housekeeping rules for the session. Please keep your cameras turned off and mute microphones for the duration of the presentation. We request that you please send any questions on the chat box through the chat function, and we will have a 15-minute question and answer at the end of the session. Before we begin, I would like to hand over to Kashish to deliver a formal introduction to this series of talk sessions, a short background on the IEEE. Thank you.
Thank you so much. So giving you a brief introduction about IEEE. It's a student-led organization and an affiliate of the International Society of Surgery. Our main aim is to promote global health equity and global surgery. And on behalf of all of the executive team, I would like to thank Dr. Rashed for taking the time out of her schedule to share thoughts on a very important topic of women in surgery. We have started this talk series to have interactive sessions with the experts. So please keep posting your questions in the chat box. IEEE is fully committed to creating a student-driven movement to represent the diverse needs in the field of surgery and education throughout the globe. Thank you. Over to you, Dr. Rashed.
Thank you so much for having me here today. I'm very happy to be a part of this series. So today, I'll start by sharing my screen. Can you see my screen?
Yes, we can, Doctor.
Okay. Thank you so much again for having me today. So today we will be talking about women in surgery and inspiring the next generation. First, I would like to say that I have no conflict of interest except being a woman presenting this topic. Over the past few days, I have read the book Becoming from Michelle Obama. And what struck me in this book, the amazing impact that she had during not only her being the first lady, but also throughout her life. And something that resonates with me that she wrote in her book, your story is what you have, what you will always have. It is something that you own. And with that, I'd like to tell you that today what I'm going to do is I'm going to try to share my story with you in hope that my story will inspire you, will broaden your horizon, and guide you not only through your journey in medicine and surgery, but hopefully in your life as well. During this talk, I will be also highlighting some of the barriers and the challenges faced by women and how can we overcome it. And we will be talking also about how to create a supportive and inclusive environment. So for those who does not know me, since this is an international meeting, I'm from Kuwait. Kuwait is a very small, tiny little country that is in the Middle East. If you look here in the globe, there's a very tiny little spot there in a white color. That's my country. This is where I come from. The population of Kuwait is also a small population compared to other countries. It's only 4.2 million, with actually Kuwaitis being the minority in their own country. So as a kid, I was very social, very energetic, very competitive. I almost questioned everything that did not make any sense to me. My both parents have studied science and they both believed in education. And I had an uncle who was a surgeon. And one day when I was around 12 years old, when I was in a weekend in a chalet, I've seen a video of him performing the resection of a gastric tumor using the GIA staplers. And at that time, it was just new tools that have arrived to Kuwait. And he was excited to show that. And for me, that was very fascinating, how the anatomy was, how the tools were, how did they use it, and so forth. And from that time, I was very inspired that I really wanted to be a surgeon. I did not understand the meaning of how complex the journey during the surgery to be, but it's something that actually spiked my interest into the field. When I went to high school, I was actually very interested in science, but they told me that math was the toughest major, and therefore I decided to major in math. I was, as I said, very active, very social. So I enjoyed getting to know people around me and have great connection and friends. And I was very competitive. I loved enjoying sports. I actually was on the basketball team. That's not my photo, but because at that time, unfortunately, we did not get that. I was also on the basketball team, as I said, and that's my class. Actually, I couldn't find myself there, but that's my class. So a big class of students who graduated that year. And throughout high school, I was very interested into, I had a high sense of justice and really wanted things to be fair and so forth. So I actually joined the student council from being a general secretary all the way up until I became president over the last 2 years of high school. So when we move on forward, and after high school, what happened is that I got a scholarship to study, to go to university to study medicine. And in the notion that I was going to be a surgeon, I did not understand the difference between a surgeon and physician at that time. So, however, I really wanted to study in North America, but due to cultural factors, my choices were limited, and therefore I studied in Bahrain, which is about an hour in the airplane from my country. Now, from when I was there as well, when I was a student, I was also interested into helping students around, helping fellow students. So I was the vice president of the Kuwaiti Medical Student Club, and then later, the year after, I became the leader. Now, after I finished my medical school, went back to Kuwait, started to do my internship in Al-Amiri Hospital. And then after that, my heart was set that I'm going to go to do my postgraduate training in North America. I get married to my husband, who's also a physician, and he was my classmate. And then that made things a bit more easier for me to be able to go abroad. Although when we applied, I did get the scholarship to go to study my postgraduate, my general surgery boards in Montreal, but unfortunately he did not get the same scholarship on the same year. So, but we moved to Canada anyway. And there in Canada, within the first year when I was there, he got accepted into Alberta University, which is about 5 hours in the plane from Montreal. So that was a bit difficult decision to be made, but it was important. So, and then toward that time, I actually found out that I was pregnant with my first son. And that was completely unplanned. and it was really difficult to be pregnant, first time, alone in a new city, in a new program, and then my husband had to move to Alberta to start his studies there. And then, so after I had my son, he was able to actually transfer to Miguel. So that to enter a medical program at Miguel University the next year. So that made things a little bit more easier. Now, after that, I was very interested to continue my education, and I wanted to go to do critical care. And I did do it in the same place. But I had my second child toward the end of my training. And that was at least appropriately planned in terms of our family. The other obstacle that I had is that when I wanted to do my bariatric surgery fellowship, I had the scholarship to go to Laval University, which is about 3 hours in a train from Montreal to there. And the other challenge it was in French language, so it was very difficult to get that ready before in a very short time to be able to go there and move forward. But the decision was that I was going to do it. So my husband stayed back in Montreal with the 2 kids, and I went back and forth, took the train every weekend to go and move from Montreal to Laval. And then toward the end of that that year, I got pregnant with my third child. And then the reason I'm sharing this with you, because we often talk about the challenges and the barriers and all the other issues, and many times we skip the social part, and this is actually a very important part that, especially for women, if they were considering having children and so forth. So after we completed the training, we moved back to Kuwait. And then when I moved back to Kuwait, I started in Al-Amiri Hospital. And it was a bit difficult to adjust from being in Canada back to Kuwait. And as I have took more roles, in addition to my clinical roles, as academic roles and so forth, I started to notice that there are some challenges that made me ask the question, if these challenges are related to gender, was it related to the system, or if it was related to the work environment and so forth. And with that, started to talk to the surgeons around me, the women surgeons around me, and inspired by the Association of Women Surgeons and Dr. Newman's experience, I thought that creating a similar network between the women surgeons in Kuwait would help understand if there was a role for gender and so forth. And therefore, in 2018, we started the group for the women surgeons of Kuwait, and we went to as I said, our country is very small, but the numbers as well of women are small, and they're scattered around hospitals. So the formation of that group was initially to start working, to start to know each other and build on so forward. And after that breakfast, we got invited to the Kuwait Association of Surgeons conference, where we actually had a session that is dedicated for women, and we invited, if you can see here in the picture, Dr. Patricia Newman, who was the founder of the AAWS, along with other prominent surgeons. And then from that onward, more responsibilities, more achievements and work that was geared toward the women surgeons. So what happens is that we requested a foundation, to start a foundation within the Kuwait Association of Surgeons. It was important to have the men with us to believe in the mission and the vision of the women surgeons of Kuwait. So that was in 2019, and then afterwards we started to build on that experience and work toward our goals, which was to strengthen the presence and the contributions of women surgeons in the surgical society, promote wellness among women and self-development, as well as raising the awareness in the local community. Because one of the things that is really important and crucial to the progress is that as surgeon, we are taking care of our patients, but at the same time, or as clinicians even, but it's at the same time, often there's a disconnect sometimes between the work in the community and the healthcare. So it's important to lead lead through service and integrate community service to the clinical work as well. So here there are multiple pictures of different activities, some involving our women in research, social gatherings, workshops, and also in the community and so forth. One of the other important things as well in terms of our experience is that utilizing social media to disseminate and inspire other people, not only in Kuwait, but also outside Kuwait. So here you can see that many of our activities, we try to get the world engaged through social media. As I said earlier, to have women ally is extremely important, especially that women are a minority in the surgical field. So Women Surgeons of Kuwait has promoted for he for she. And then also expanding from our local to our regional to the international, it was important to establish connection and partnership with professional international surgical societies, which we succeeded to have, not only for the committee itself, but also to involve the resident and so forth. These are some of the pictures that we had with our colleagues in North America and the UK as well. Moving on, we were able by the November 2019 to actually have our first Women Surgeons Conference, which is actually the first in the Gulf region. And throughout the coordination with other Gulf pioneering women, we were able actually to get all of them to be present into that conference. And we had like the Women Surgeons of Kuwait conference, as well as the first Surgeon of Gulf meeting. And this is our picture with our colleagues from the Gulf, as well as in the presence of some of our colleagues in the American College of Surgeons and the Royal College of Surgeons of England. You can see here the side is the closed meeting that we conducted with the pioneers of the Gulf to sort of promote and establish and initiate the work as well in the region. So in the rest of the GCC countries or the Gulf countries. And we end up having 6 recommendations with the notion that each country will be working with that. Of course, as everybody knows, globally, the COVID crisis had hit hard the whole world. The women surgeons had been leading through that. So through holding online educational professional activities in the region as well as globally that addresses important issues such as, for example, the managing microaggression, for example, but also leading on the ground through having practical guidelines that surgeons will be able to utilize while treating surgical patients with COVID. So these are some of the things that we have done in a short span of time, as well as the return for surgery. Now, as I said, all the women have contributed really highly. There's been a lot of organization on the ground, our junior resident, as well as the consultant. Sorry? Our residents have been involved in clinical care, doing critical care, doing hands-on and drills, so we know how to deal with COVID patients, and also being innovative and manufacturing and producing the swabs for to meet the local needs. And I forget to mention as well, some extreme cases where like delivering women who have been on ECMO and had their babies. Another one of the milestones as well is the Women Surgeon Research Network that we have founded in September 2019. And the goal with that is to create the opportunity locally for physicians and students and a lot of other healthcare providers to be able to participate in research. This opportunity was not present before, and this is one of the things that we worked hard to have it up in the ground. And as I said, we produced a lot of important work, including some of the historical publications, and we have also 2 major studies that are coming very shortly. The other things that we think is very important is that foundation of mentorship program, and we'll be talking in a little bit about the role of the mentorship when it comes to the obstacles. So we are happy to to found the mentorship program, and this is the second year for the program. We started with the 3 mentors and 4 mentees, and now we have 4 mentors and 8 mentees. And then there is more to know and talk about the women surgeons experience, but that was a quick brief about that part through my journey. Now, as I said, in 2020, the Saudi women started to they had their first conference, and then the second Gulf meeting. And then what really makes me happy and inspires me myself is actually having the students going and starting the AWS chapters in the Gulf. So we have in United Arab Emirates now, and then in the Middle East, there's Lebanon, and I think recently Jordan had started their chapters. So let's take a pause a little bit now and just shift a little bit in terms of the talk after sharing a part of my story with you. And I want you to take this look at the numbers of women in surgery in the globe. So for example, if we want to look at the United States, only 20 women are the chairs of departments. Only 8% are professors, 13% associate professors, 26 assistant professors, and 19% of total American surgeons are only women. So similarly, if you look at the UK, they have similarly, they are underrepresented when you look at the numbers. And there is, the numbers are important because it conveys a lot of things. So for example, 25% of pediatric surgeons are women, and about 20% are in the other surgical fields. So closer to the state, probably. If you look, and in total, 11% of the UK of the surgeons in the UK are female. So 19.2 the Americans, 11.1 in the UK. And with that, they speculated that it will take up to 2000, maybe 136, until we are able to attain maybe about 50% of full professors. If you look at other countries, it's in other continents as well. For example, in Japan, 7.2% of the surgeons who had membership in the Japan Society of Surgeons in 2014. If you look at Australia, around 12% are women surgeons. And if you look at Africa, around 9% of all surgeons were women. However, there's been recently a lot of work with international professional societies in Africa, and they quoted that there has been an increase, and they're up to 14%. Still, if you look at that, if you want to look at the Gulf data, for example, if you look at women in the government practice, so these are at the level of about consultants, so about 17% in Bahrain, in Kuwait about 9.3%, in Saudi Arabia it's about 20%, and if you look at Qatar, but this is only one single center, it's about 44.8%, so that's not very reliable. So if you look at all these numbers, you come to the understanding that women still, although if you look at the numbers here in the table, for example, in the Gulf, and this is similarly as well in other parts of the world, that most of the female graduates from medical school are actually higher than men. So for example, in Bahrain, 74%, Kuwait, 60%, Oman, 86%, and so forth. And if you look at the state data, and most of Europe as well, many places in Europe, the medical student graduates are actually mostly female, but that is not really reflected later on in practice, as you can see. So this will bring me to talk about the barriers and the challenges for women in surgery. So just to have a broad look to think about it, so they can be on different levels. So there are barriers and challenges that we may put a pause for ourselves. There are barriers that maybe the environment or the direct environment around us. So for example, where you study or where you live, or who are the people right next to you. And then there are things that are related to the system. So for example, it depends which country that you work on, or which hospital that you work on, what are the registrations and so forth. So we'll dig a little bit more here, and I'll speak a bit more about the challenges here. So, for example, there are different studies, and I did not put all the studies that I brought this from, but just for you to know, perception of society, social responsibilities, tradition, and culture plays a significant role when it comes to women choosing the career in surgery. We do know that attrition, intimidation, and harassment as well plays a factor into women choosing surgery. Now, many studies that have shown that not having a mentor or the mentorship is actually related in terms of you going or choosing surgery and so forth. Some of the studies looked at perceived access to postgraduate training. So if you are interested in surgery, but you do not have an access for postgraduate, they might put you off to actually choose surgery. Perceived heavy workload. So students who think that surgery have a lot of heavy work may make them feel less likely that they want to join the surgery, as well as perception within the medical profession. Some of other health care professions may not look that surgery is a field for women. Length of stay, the longer your study, so you have to finish medical school and then you have to do 5 years of training and then another 2 or 3 years in fellowship. So the longer the study, it would put people off into joining the surgery, as well as if you would have financial support, or if you are from the lower middle or low economy countries as well. This could be a factor for you, for somebody who is trying to pursue surgery. So I'm going to show you this study that looked at barriers for women entering the career of surgery. So it's a cross-sectional survey, and it had a 639 med students who completed that survey from 75 countries. And what they found is that there's decreased likelihood, especially for women, if they perceived that there is no access for training afterwards. Increased year of study, perceived heavy workload, this across all was equal for men and women, but mostly for women, the perception of access for postgraduate training. On the other hand, you will likely to pursue a surgical career if you have mentorship, the acute element of the surgical specialties, academic competitiveness, and being from a higher or middle income country as well. And then, so in conclusion, in that study, what they thought is that for the perceived poor access as well as heavy workload may be actually a consideration that trainees will not pursue surgery, but it was very significant for women that postgraduate training actually affected their choice. And then the rest of the factors have been equivalent to men and women. And as we said, mentorship have played a very important role in terms of choosing the career. If we want to look at the underrepresented minorities, okay, the underrepresented minorities, for example, this data are from the state. Majority, as you say, are the non-Hispanic whites. But then if you look at the underrepresented minority, African Americans are about 4.4, followed by the Latinos about 4.8. Another study as well looked at all surgeons with the rates that the lowest will be among Latinos and African Americans. And this is important because, as you know, there's increased heterogeneity in the population. So it was important to answer this question when you want to build on the workforce. So this study actually looked at that, and it was a semi-structured interviews that explores structural and perceptual barriers among African Americans and Latino surgeons. And they found that there are 3 themes that actually made the difference, which are creating path to medicine, to surgical culture, and then to mentorship. And under each of these, there was like a sub-theme. And in their conclusion, they think that they notice that it will heavily influence, if you are like from the underrepresented minority, you will be heavily influenced by mentors, and the feeling of belonging, and therefore this should be beneficial for those who are seeking that. And it will be important to identify aspirational figures, for example, and have structured introduction to the rigors of the profession, as well as deconstruction of negative surgical norms. So we heard about and we discussed a little bit about the barriers and the challenges. So how do we overcome these barriers? So if we are to look at the what we're doing now, for example, we know that there is a global movement that is moving in terms of empowering women, not only in medicine and surgery, but also across all sectors. So that is working into our favor. So the more we collaborate and move forward together, that hopefully will help dissolve some of the barriers that we have. It is also important, as I said, I have highlighted some of the roles of the professional societies, whether in our region or internationally. So it's really important that this work is very important, and it will help highlight the issues for women and move things forward. It's important to have legislation adjustment. Some of the countries would have, for example, specific numbers for specific trainees to enter into programs and so forth. And then so adjustment for these legislations are important, as well as other legislations that can help, for example, with childcare, etc. As we talked about, mentorship is extremely important in terms of helping the juniors, but also the seniors into the career of surgery. And increasing women in the leadership roles will definitely set the stage for more women to be able to envision themselves into these roles. Increasing women in the surgical training, this is something we are seeing, but it's important that we keep that and push it forward. And then, as we said, a competency-based training, because if you want to look at some of the factors that will push people backward from choosing surgery, because it's a duration, like you have to be trained over 5 years versus the competency-based sort of training or curriculums. That time will maybe shorten when it comes to the duration of the study. And very importantly as well is the equal pay. So achieving equity across everything, but also pay is extremely important. We do know that many countries, most of the countries, many countries in the world do not pay women surgeons like men surgeons. Luckily, in the Gulf countries, all the Gulf countries pay men and women equally. So with all this information, what I want you to know is that as women in surgery, our role is to help equip all our trainee or medical students with all the skills and the tools to help them navigate their profession and their life. It's important that we work to create learning opportunities with them, as something that I've showed you earlier that we are able to do, and also enhance the whole experience for women. So it's not only about academics and everything, but it's also about social life. It's also about community. It's about everything. And it's important to foster any creativity that we see among our student or resident, and push for innovation. And as I said, with all that, hopefully it will be able to eliminate more barriers. Now, my advice for you, as you are starting your career, whether in surgery or as a medical student, it's important that you ask yourself, what can I do? So we talked about the barriers. So what you need to do is to think, how can I, for example, improve my home? How can I improve my work at university or at work or in my community? And it's important because you are the only one who would know best for yourself when it comes to the daily challenges that you might have. So these are one of the things that you need to think about. And once you highlight and identify these issues, your next step is you need to find support. So you need to think, who would be a good mentor for me? Who is a role model for me? What are the professional societies around in my country or internationally or regionally that can support me and help me to overcome these barriers that I have highlighted? What is your social network? It's very important that as juniors in training or medical student, we are very focused and highly focused on academics in achieving, like doing your exams, studying for rotations, which is excellent because this is something important and you need to do. But also you need to focus about your social network. Who is going to provide you support? There are times when things are difficult. Who is going to be there? But also it's important to work and know how can you achieve your wellness, as we said, surgery may be a very high pressure profession. So it's important to be able to have this equilibrium where you will be able at some point to achieve wellness when it comes to your mental and physical health. And the earlier you develop this habits, the earlier you know how to manage your time, you will have a more positive impact with this. The other things that you need to do is, as we say, for women, there are a lot of barriers. So you really need to be excellent at what you do when it comes to your studies, when it comes to your knowledge, when it comes to your skills, whatever these skills are, whether it's a skill in the operating room, whether it's your communication skill, whether it's your collaboration skills, whether it's your leadership, any kind of skills, you really need to equip yourself with that and improve it constantly. And it's important as well not to forget, because not to forget your values and to have a positive attitude toward change, because we need to accept that we have to change regularly to improve ourselves. So be open for feedback when people give you feedback. And as I said, hopefully with doing this, you will be able to eliminate some of the barriers that would come your way. So to just summarize a part of the things that I have shared with you, we do know that women are an integral part in the surgical force. Societies have a great role, and therefore they're essential to inspire the next generation. Social media is a very important tool, so please use it wisely. And at the end, we will need a bit more data that takes more details when it comes to closing the gender gap, so we can all work together to hopefully achieve that. And at the end, I really hope that my story has inspired you, as I know. And for me, I would say you are the writer of your own story, and make it your masterpiece. And with that, I would say thank you.
Thank you so much, Dr. Al Rashed. I think that was a very inspiring talk and also very informative. I think the perspective of the surgical aspects and factors that we as women face as aspiring doctors is one that is not often spoken about. So I think that was a very, very valuable insight. Thank you. We're just going to go through some of the questions that have been submitted. A few of them have actually now been answered, but I'm just going to highlight some of the ones that have not yet been. So the first one is, what motivated you to pursue bariatric surgery?
Hello? I think you said what motivated you. What was the rest of the question?
Sorry. The question was, what motivated you to pursue bariatric surgery?
Okay, all right. So at the time of my, so I was as I was starting to do my critical care fellowship, we know that obesity has been rising. And actually my uncle that I referred to earlier has been, bariatric surgery started to be more evident in Kuwait. And he actually, he suggested for me that, why don't you look at bariatric surgery? I was not looking at bariatric surgery at all. I was going into either vascular surgery or transplant surgery. And that was around, I was in my third year. So I wasn't sure at that time which one I would choose, because I loved both of them. And by that time, I only had one son, as I mentioned. So I started my critical care fellowship. And then as I was doing my critical care fellowship, then I started to learn more things and realize that as a lifestyle, if I am to choose vascular surgery or transplant surgery, these both surgeries are not very well developed in Kuwait. And therefore, when I get back, knowing me, I will be spending a lot of time to create a lot of things, and I might not be able to achieve, changing the standard because of the lack of the numbers of surgeons, for example. I cannot create surgeons, right? You might be able to create a program or a service, but if you don't have the manpower, it will be difficult. And therefore, I said, okay, maybe bariatric surgery would be good. And then toward the end of my fellowship of the critical care, started to read more about obesity and then realized how significant that problem is. And then I said, okay, that's what I'm going to do, because this is like really serious and it's really important. And that was exactly what that was initially why I chose to do it. And of course, I love laparoscopy. So bariatric surgery gives you now also all the, laparoscopic aspect of doing the surgery.
Thank you so much. The next question is, seeing as you've mentioned you have a family with 3 children, is it easy to find and spend time and holidays with them?
Okay, so so easy, I wouldn't put like it's easy, but I think it takes important time management and scheduling. So one of the things that I told you is that my husband is actually a physician. So he was actually, as I was doing my residency, he was doing his own residency as well. So it was very important that we would organize our weekends. So one of us will be present at home when the other one is not. So it's not easy, but it's doable. You can do it, okay? So, and that depends as well, as I said, you need to have a partner or a husband or a spouse who would be supportive of you, who would share the same beliefs as you. And as I said, family is the responsibility. In many places or many cultures, the woman would take most of the bulk when it comes to the household. So in that scenario, you need to have a shared responsibility. So you would agree to have certain things, and then your partner will agree to help with other things. So time management is important. Having a supportive, I would say, system, a spouse, a partner, whoever who would help, and then you'll be able to do it. It's not easy, but you can definitely do it.
Thank you so much. I think that's a massive comfort to all of us in the audience. The next question is, do you have experience working in a toxic team environment? And if so, how did you navigate that?
Okay, absolutely, yes. I think most of the people who worked in surgery, not only in surgery, honestly, in medicine, there is a lot of toxic environment, and there is still. So it depends on multiple things. First of all, it depends where are you in the training, so you know what can and what can't you do. But I would say that being able to be open in terms of understanding sometimes that things are not personally toward you. So like if you look at people who, for example, microaggression, if you look at bullies, you need to learn how to deal with these situations. So rehearsing of specific scenarios that can come when it comes to, for example, also harassment and other things. So rehearsing that, practicing what would you do if somebody said that to you, or what would you do if somebody did this for you? So this can help you. Number 2, you can educate yourself and read about these topics. There's a book that was published about the gender equity in medical profession. I think it would have some of the chapters that would address how to deal with your environment. So I think that will help you. And it's important, as I said, whether you are at work, at university, or at home, you always have to have and build your network, your social network, your comfort, the people who you can actually take advice, or not even take advice, sometimes just to vent out and find out if there are other solutions. So I think these are some of the things that I would suggest for you. Educate yourself, rehearse the situation, and if you try many things and it doesn't work, if you have the option to actually remove yourself from that environment, that is also an option that you can do. So for example, if it was a short term thing, like you're doing a month rotation, so maybe this is something you can use this thing good. But if you're like working in a place and you're going to be there for like years, and there's no way that environment will change, then it's a consideration that changing your environment will be an option as well.
Thank you so much. And the last question, I'm actually going to merge them because I think they might have some overlap. So the first part of it is just asking if you have any advice for female surgeons who are now aspiring to become surgeons, which surgical fields you would then advise we follow, and whether there are any specific limitations or restrictions that are specific to a subspecialty within surgery.
The second question was what?
So are there any limitations or restrictions that are unique to different subspecialties of surgery?
Okay, yes, okay. All right. So I would definitely recommend that for you to explore what's out there. Like for me, I was going to be a surgeon. I just wanted to be a surgeon. I did not know, like this is very early on, as I said. But then as I did my rotations as well, I enjoyed general surgery at the beginning. But again, because I didn't have a lot of exposure out of the general surgery. But when I went to my training in Canada, and I've seen a lot of how the different subspecialty extreme, a lot of different specialties with a lot of subspecialties, I was like thinking, oh, that would, like, if I did not become this now, I would choose to be that kind of surgeon, you know what I mean? So I would highly suggest that you would look at surgeons from different specialties. How's their lifestyle now? Because residency is like illusion. It's not real. Nobody lives like a resident forever, okay? So this is a temporary situation. The crazy way that you can't sleep, you can't eat, and it's like very hectic. This will change, and some of it will change quite differently when you choose your subspecialty. Like bariatric surgery, for example, I don't get to, like in a whole year when I did my fellowship, I think I went to the hospital midnight twice because it's based at elective surgery. Everything is very well done before, so patient does not have high rate of complications. So choose, and then, but at the same time, choose something that you enjoy doing. Choose something that later on you can grow, will give you alternatives, different pathways that if you find yourself that you want to change, for example. And then I would highly recommend subspecialties in terms of, like, I wouldn't do just general surgery and that's it. If I choose general surgery, you need to choose the subspecialty because the science is evolving so fast and there's a lot of new, more complex subspecialty that comes. So that's what this is what I would suggest. And then also think about something that will make you make a decent living. Because again, I do understand that some of the students have loans and have a lot of financial commitments even before they start their career. So I was lucky, I did not have that issue because I went on scholarship, so that I didn't have to pay for it. But if we're talking globally, then we have to be open for different people from different countries. So if you so this is also financial aspect should be on your list when you make that decision. And also, as I said, the lifestyle eventually. So if you are somebody who loves to be on the go, you love the adrenaline rush, you might want to become a trauma surgeon or a vascular surgeon, for example, or a transplant surgeon. And also where you're planning to work. So if you're going to work, there's no point of you going into a specialty if when you come back to your country, or you are in your country, you're moving somewhere else, they do not have that service. So choose something that you will be actually able to get a job to do. Now, this is for the first one. The second question, I sort of answered that questions. I don't think, I mean, there's, again, the restriction would come according to the country, maybe where you work. For example, in certain countries, there are surgical procedures that would overlap between some specialties. But then, like, for example, ENT, neurosurgery, ortho, plastic with general surgery, and so forth. So it depends where you're working at, that you might have some restrictions when it comes to working with your subspecialty.
Thank you so much. I think we have time for one question that's been submitted in the chat function. The question is, Doctor mentioned picking out the problems found in our environment and addressing those. What are some examples from your own experience?
Okay, sorry, can you read the question one more time?
You mentioned picking out the problems found in your environment and then addressing those. So what are some examples from your own experience?
Okay, so so sometimes, for example, you could have, so it can be on variable levels, okay? For example, the issues that I would have in my early years in training would not be the same. So I would say, for example, there are cultural things that was, for example, different from when I studied in Bahrain when I went to Canada. So then you need to adjust to the cultural norms where you're working, for example. So this would be one of the other issues as well. As I said, when it comes to hierarchy, for example, every place works differently. So there are some, this is what I would say, some of the things that I come across. Also, sometimes we have perceived ideas that are wrong. So when I found out that I was pregnant with my first son, I was like, first of all, I was shocked because I did not plan to have my son. But at the same time, I thought that I will be kicked out of the program. And I was silent about it. I wasn't sure what to do. But then obviously I was going like, it's going to be obvious, we're going to see what's happening there. So going to, for example, went spoke to my program director, because for me, that was an issue, that was maybe a barrier. I might not be able to complete the program. This will change my life. And then when I went and I sat with her, and then she told me, there's no rule that says you cannot do that. And I was lucky because also she was a woman, so it was a bit easier that I would, and I know she was a recent mom. So for example, that helped me. So that barrier was a perceived barrier. It wasn't true, but I thought it was a problem, right? So she helped me, and then she also explained for me what are the time off that I can take for me, for example, to qualify to do my exam versus not. So I think this is one of the examples that just comes to mind like right now.
Thank you so much, Doctor. And that's all the time that we have for the questions. So I'm going to hand over to Akatia.
Thank you so much, Dr. Asmaa, for this enlightening presentation. And thank you for the audience for sending out your questions and attending the session. I hope you all had a great time and I'm sure that all of you all got inspired by such an inspirational presentation. Thank you so much. With this, we end the session here. Thank you.
Thank you so much. Have a great day. Bye-bye.